Well, welcome to Senior Connections. This is a program brought to you by Senior Resources, the area agency on aging that serves Muskegon, Oceana, and Ottawa counties. We come to you every month and try to share some information about programs and services available to older adults, their caregivers, and families and friends. And we cover a variety of topics from Medicare benefits to programs in the community and everything else in between that we think is important to you. And so, you know, we're, I don't know, however many months into the pandemic right now in November, and we're always trying to figure out constantly how to connect with services and people in their community. And so today we're going to talk some more about some of those programs and two of the really important ones in the community year-round, but especially during the pandemic. So it's my pleasure to welcome back Stacey Gomez from Call 211. And I guess the first time that I've had my good friend Mark Evans from AgeWell Services on. So nice to see both of you.
Nice
Thanks.
to see you. Thank you.
So Stacey, you were here in February. Mm-hmm. You were my last guest before the craziness of the pandemic started. So we always bring you here in February because it's the second month, and the second month, the 11th day is 211 day. For those obvious reasons. And so we were talking then about all kinds of programs, but now it's been a little bit changed. So as we sit here in mid-November, COVID cases are on the rise tremendously in our region. Thus, normally we don't have people wearing masks in our show. I'm not, because I talk a lot and need to, but I want our guests and all of you to be reminded of the importance of wearing masks, so we're going to still do that. During this pandemic, certainly Call 211 is more important than ever before, and I know you have been crazy busy and you're going to tell us about that. But before we get into some of those specifics, just remind our viewers a little bit about 211 as a whole, what happens when they call, before we get into specifics of how things are changed. If somebody why do they call 211?
Yeah, so 211 is a Health and Human Services information and referral. So the program is available 24 hours, 7 days a week, and individuals can just dial our simple 3-digit 211 number. We also have a local number, 231-733-1155, as well as a toll-free number that individuals can reach us. They can also text their zip code to 898-211. They can go onto our website, which is call-211.org, and contact us there via email. They can search for services themselves from our database that's available on our website. And any way that they choose to connect with us could be that they're looking for human service-related services. It may be food, it may be a utility bill shut-off. As we're coming into the holiday season, individuals looking for Thanksgiving program, meal baskets. Certainly COVID has changed things besides wearing masks, like Mark and I are. And many agency people are having to wear masks in their daily work. Mm-hmm. It's also changed the service delivery. So because individuals aren't able to do those congregate holiday meals, they're changing and maybe doing a meal pickup, or in the case I know for the DTE dinner that's coming up, doing a frozen meal that individuals can pick up. So we're trying to really stay on top of all of those changes and provide that information to individuals who contact us. So there are an incredible amount of services, whether those are COVID related or not, that are very much available to residents in our community. And if anyone is looking for help, or if they have a question, they're not sure where to go, or if there's even something out there to help them, we encourage them to contact us.
And they can call you any time of day or night?
Anytime, day or night. With any kind of question or concern that they have, it is a judgment-free zone, so we welcome all questions and concerns. Individuals do have the right to remain anonymous when they contact us, so that's important for people to know. But we will ask callers, in addition to their zip code, so we know where they live. We'll also verify their municipality. And sometimes we have individuals who maybe the zip code is split, so sometimes we need to know exactly what county they even live in, and Holland is an example of that. But we're going to ask if they're willing to share their name with us, which allows us to kind of keep a history of things that they've called for. Mm-hmm. And if they happen to call us back and one of our staff can see, a week ago they called for food pantries, now they're calling again, what was their experience with those food pantries? Did they receive the services they needed? And it allows us to follow up with them that way as well.
So I always like to tell people that they might call you for one need, but come out with a list of a lot more than that, because you're not just saying, okay, you need help with food pantries, but if you need help with food, the chances are really good you might need help with something else.
Absolutely.
Or you might not be able to have a service that will help with that need, but something else that may help them be able to move their budgeting money around.
Because it's important to know and understand, maybe someone has had a change in their income. Maybe they lost a position, were laid off, and that's why they're seeking help with food. But they may then also find themselves struggling to pay future bills. So letting them know that if they do run into a past due amount with their utility bill, and talking about some future steps they might be able to take and other ways why they might want to connect back with us to take advantage of that. We also do screening. We're asking individuals if they are receiving SNAP or food assistance benefits, if they're a veteran, because there are certainly veteran services, and doing that screening. Asking if there might be, young children in the home, early childhood. There's lots of different programming for the 0 to 5, making sure the parents or guardians, grandparents, are connected to those services. So a lot of screening questions that we ask, but it really all is to be able to direct them to the most services and the most appropriate services for what they need.
Right, and you cover more than Muskegon County, but certainly if you find out somebody's older, over 60 and a Muskegon County resident, there might be senior millage things as well.
Yes, exactly.
So knowing those municipalities, and when you talk about that split, I think of Casnovia Township, where it's split between Muskegon and literally the side of the road you're on can make a difference.
Yes, it can make a difference.
For those counties.
Yes, and where they live, because I know, speaking of the millage services, so we may have a service that could serve City of Muskegon residents, but the other program that serves the rest of the county's residents may have a wait list or be full for their services. So it allows us to understand and make sure that we do not refer a Norton Shores resident to a City of Muskegon program and vice versa.
Right.
So
there's a lot involved, and I don't think a lot of people, even in the Health and Human Services field, understand all that you are keeping up with, because you need to know some of that information to report to your funders.
yes.
Certainly. You need to know it for the services, but your information is only as good also as what is provided to you. So sometimes people will get frustrated, but it's up to all of us in the Health and Human Services to provide that information as up to date. Okay, the funding's out, we don't have it, or it's coming again in this time.
Yeah, and our resource specialist staff, so Sarah and Allison, are the ones who are contacting agencies, which sometimes I know as an agency who's receiving those requests, it can feel a bit like pestering, but it's really to understand and not make inappropriate referrals, because we recognize agencies have shifts in funding, they have changes in staff, and COVID is another example. We've had to change how we deliver our services, and so understanding that so we can communicate it to residents is really helpful.
So let's talk about that. You've been with Call for how many years now?
18
So you
years.
started as a baby. So right out of high school, and you started with Call. So you've seen a lot. Probably not any more, though, changes-wise than what you've seen in 2020.
That's correct, yes.
Crazy.
It is.
So how has that changed for you at Call 211?
For our agency, fortunately, our programming has not skipped a beat. So on March 24th, our staff had to all begin working remotely to be in compliance with the governor's executive order at that time. And we worked remotely until a time period in August when we began coming back into the office, and we have a hybrid schedule. But whether we were working remotely or in this hybrid schedule we now have, all of our contacts have been answered. In fact, our pace has picked up. We have 3 new partnerships statewide with the Michigan Department of Health and Human Services that are COVID-19 specific. So our contact volume is very, very high right now.
I would imagine. And I do want to talk more about those state programs in just a second, but what have you seen different? Do you have a lot of people who've never called before? I'm guessing that you would, because we've got people who've lost jobs, even if temporarily. We know how the state shut down earlier in the year. A lot of people haven't been able to come back, or things are different. Have you seen a lot of first-time callers or a lot of changes in that?
We have seen new first-time callers, and I will say with our COVID programs that we're doing, we are collecting less data than we typically do on our 211 calls. But we certainly have seen increases in individuals who are calling for test sites, as an example, that those are people who have not contacted us before, and persons who were experiencing unemployment, especially when this first started and having some difficulties perhaps with that, seeing some people who had not called us before.
So talk to us a little bit about those new programs through the state that are keeping you insanely busy.
Yeah. So in June, late June, we started, and this is a statewide effort, so all 7 211 programs across the state are doing this work, but we are providing referrals to test sites across the state, and then also providing the scheduling assistance. So some of the test sites only have an online registration, and if you do not have access to the internet, you need someone who can help you make that appointment, and that is us. So we provide that service to individuals. So I know just the other day, Mar in our office, was speaking with a 93-year-old woman who did not have access to the internet and made her, appointments that were necessary for the COVID testing. So we continue to do that. We also began providing what is called the quarantine and isolation navigation service. So for individuals who have been directed to quarantine or isolate due to COVID and who may need help with community referrals, so kind of traditional 211 service, or who are needing access to apply for Department of Health and Human Services public assistance programs through My Bridges, but don't have access to the internet, then we can help them with that. So which is really helpful because some people may not have the internet, but would typically go to their daughter's house or another relative's house to use the internet, and can't do that if they have COVID or if they are under quarantine orders. So we are providing that service, and starting October 1, we began answering the state's COVID hotline. So when individuals call that toll-free number to reach the state for COVID assistance, they are actually being referred to 211. So
then does that get sorted by, how does it get sorted to you?
yes, so that comes when they dial that number, it automatically routes to 211. So the state was actually using the same phone system that we do for that hotline to begin with back in March. And so when they asked if 211 could take that over for them, it was just behind the scenes transition. And so they come in on a particular skill in our phone system, and then we're able to assign certain members of our staff that skill, which helps us in navigating all of our calls.
And all of that you're doing without all of you being in the office at the same time, because
Yes.
I know how tiny your office space is. So you have a lot of people. Well, I don't know, a lot
Working remotely.
but they're working remotely, or they're alternating days and things
Yes,
for safety,
they are.
right?
Yes,
Good to
yes.
hear. So about a year ago, you started a wonderful new program. Who knew when it started last fall how important it would be, the telephone reassurance program? And I remember when we talked in February, you only had literally maybe two.
Yes, we did. We had only 2
in
participants.
February.
Yeah.
So tell us a little bit about that.
Yes.
And how it's grown.
Yes, it has. So at this point, I think we have 20 active clients. We have had a couple of clients who are no longer participating in the program. Some were COVID related, and one gentleman unfortunately passed away. And these individuals, it's really for anyone who is age 60 or older and who is homebound. Now with COVID-19, fortunately, we're able to serve individuals who may not normally be homebound, but due to COVID have been instructed, especially by physicians, to stay home. And so this program is open to them as well. And they can contact our telephone reassurance number, and if they do not have that, they can always dial 211, and we'll make sure to help them.
Sure.
So we have an application for that program, which is very simple, but that application gives us information about that individual, where they reside, obviously their phone number and email address, whether they live with another relative or another person, and who their emergency contacts would be. So if we needed to get in touch with someone if we couldn't reach them. And we will make a wellness check, or we will make social calls to those individuals. And we are thankfully getting a volunteer component up and running now, so we're so very close to having that ready. Our staff have been the ones who have been providing these calls at this point. And so most of us have 2 or 3 clients that we are calling on at least a weekly basis, some more than once a week.
So it's been a great program to help with social isolation and
It has been really great, and we have had a lot of positive feedback. I know one gentleman had shared how the call is the highlight of his week. And just a really nice, and it's very different than our 211 program. I mean, having a regular conversation, whether that's weekly or a couple times a week, and getting to know, these individuals and their lives and what they did for their career and their friends and experiences. It's really enriched our staff. And been a wonderful experience.
I'm excited for when you get the volunteer component, because I think there are going to be some people who will really benefit from being the volunteers for that and doing that relationship as well.
It's been wonderful.
Well, it's a tremendous growth in a year. And
it is, and we want to serve more people, and we know that there are more people who might benefit from that. And I would just say, even if there's someone who maybe isn't sure they want to talk to someone all the time, we would be glad to send email. And have conversation by email. So,
wonderful.
Yeah.
So one last thing before we get to Mark. So here we are in November. The holidays are approaching. You touched on this a little bit. Every year, Senior Resources gets a grant from DTE, which we then partner with AgeWell Services to do a holiday meal. And of course, you've been part of that because you've done the scheduling for years now. And this year it's a little different, as you alluded to earlier, because it's not safe to do congregate meals, which is so sad, because I always, and Mark, you know this from just the short time being in Tanglewood Park, but when you were there too, you know how cool that is to see the energy, feel that energy there. But they're still doing the meal. It's going to be frozen, and they're doing grab and go locations and things like that, and still doing home delivered. But talk just a little bit about your role in that.
Yeah, well, in previous years, we have done the reservation handling for Tanglewood Park and provided information on the other sites that individuals could go to. And this year, I believe, whenever AgeWell says it's going to start, so we're prepared for when that is going to be, but I don't know that they've announced when that date is yet. But individuals will be able to dial 211, and we will take the reservation for one particular site in Muskegon County where they need to have those reservations, even though it's a meal pickup. But for all the other locations, including Tanglewood, we'll be providing information on what is contained in the dinner itself and when they can pick that up, what those locations are. And because I believe Tanglewood is going to be first come, first served, we'll provide that information. And the other sites, which we're waiting just to get the list from AgeWell and what those will be. I know that they are going to be contacting that site and signing up. So then we'll provide them the contact information for that site, whether that's
call 211 if you need to know anything about that or any other.
Yes.
Anybody who's watched the show knows the last things I say every month are, if you don't remember anything else I told you, call 211.
Yes, we will do that. And we will, when that starts, I believe we're going to take the calls Wednesday through Friday. For that program. And when you dial 211, there will actually be an option on the phone system that if you're calling for the DTE holiday dinner, to press X number, and then it'll route you right to the person who can help you with that.
So, well, speaking of AgeWell, my other guest is my friend Mark Evans, who oversees the Senior Medical Transportation Program. And so, Mark, you've been managing this program for a number of years now, from back when it was with the Red Cross. It was with American Red Cross until
July of 2019.
It seems like you've been at Tanglewood Park, well, except for that we haven't seen each other much for months. But so tell us a little bit about you. We have about 10 minutes to focus on your program, but it's so important, this medical transportation program. But tell us how you came to the program and what you think about it.
Sure. Well, I'm a lifelong Muskegon resident, and I worked at the paper mill for 28 years. And when that closed, I found a new career. I went back to Baker College, got an associate's degree there. And as soon as I graduated, I went to work at the Red Cross. The job was open at that time, and I was selected to take over there. The Senior Transportation Program had been there since 1986 under Lois Brinks, but Lois was ready to retire, so I took her place and worked there until July of 2019. In 2018, the Red Cross decided they didn't want to support that program anymore, so I was asked to look around the community to see who would, and luckily AgeWell Services stepped up and took that mantle on, and as I worked at the paper mill, I was always very involved in community service. As you know, I was at the United Way, 20 years of Day of Carings, and 8 years as the chair of that, and plus I'm the treasurer for the Muskegon Lake Watershed Partnership, where we work on Muskegon Lake water quality. So I always had a heart in the community service field anyhow, so when the position at Red Cross opened up, I was really happy to be able to take that. And the nice thing is when it did get transferred over, we transported the Friday for Red Cross. On the next Monday, we were transporting for AgeWell Services. The clients never noticed anything except for the change of the door sign that who was picking them up.
Yeah, it's pretty amazing. So I'm very familiar with this program. As you said, it's been around since '86. And a lot of people do know how important it is. But for those who might not know about it, tell us the basics about who it serves.
Yes, so it's a non-emergency medical transportation program within Muskegon County. We don't leave the county, but we cover all of Muskegon County, and we cover most of the municipalities in Muskegon County. It's for seniors 60 years of age and older, and 150% of poverty or lower. We do make an occasional exception on that, at least we did in the past, but with COVID, our numbers are restricted there too. We use completely volunteer drivers. We use AgeWell vehicles that I get through state and federal grants, so the drivers don't have to drive their own car. We take people to their appointments. We do not stay with them. We drop them off, and then when they're ready to go home, they give us a call. We send the closest car over, pick them up so they don't have to wait, and we take them back to their home. So it's a door-to-door service. We pull up to your front door. The volunteer is there to greet you and serve you. You get in the car, we take you to the appointment, and it's very interesting dynamic because the volunteers and the clients really build up a really strong relationship amongst themselves. So it's a very cool program.
And so you've always had to prioritize, but probably even more so in COVID, because I know that you've had issues with a lot of your volunteer drivers are older themselves, so you've had to be very cautious. But you didn't miss a beat, really. You still transported this whole time, although you've had to prioritize. So talk a little bit about that.
Absolutely. We never missed a day for our dialysis and our chemotherapy clients. Now, the other clients, we did have a mass reduction in drivers when COVID hit. Our drivers are almost completely senior retirees themselves, and we completely understand that some of them needed to stand down. Luckily, we were able to maintain about 25 people, volunteers. We went from 65 to 25 in 1 month. So we had to prioritize those chemotherapy and dialysis runs. So we maintained them through the whole COVID. And as a few drivers felt more comfortable and started coming back, we were able to increase to doing other appointments, not as much as we used to. We're about 2/3 of capacity right now of what we normally run. We usually give around 16,000 rides a year, and this year we gave about 11,000.
That's still pretty amazing.
That's pretty good considering what happened. I was pretty proud. And you know, those volunteers who hung in there, they could be doing anything they want with their time, and yet they're choosing to come in and help their fellow man during these very difficult times. Riding in another vehicle with somebody going to a doctor's appointment seems like a pretty scary thing to most people, yet these folks come in. We do have all kinds of, we're following all kinds of protocols on safety to make sure they're as safe as we possibly can be. But you know, to have these people still dedicated enough to come in, and we've actually had a few new volunteers come in recently, believe it or not. Even through all this craziness, we've had new volunteers sign up. So
that's wonderful. And I know that's always a need, but
absolutely,
you're doing a lot of cleaning and all of those kind of things there. But that's tremendous that you still have that. So let's talk about, you know, we've got a lot of things to talk about, but let's talk about your need. Do you still need drivers?
Oh boy, more than ever.
Let's talk about that. What do they need to be able to, they need to be able to drive well. What are you looking for?
Well, okay, our drivers have to pass a background check, be an AgeWell volunteer, and a driver's check if they're going to be a driver. We also have a dispatch position where we really need people too. So it's not just drivers we need. There's a job in the office that we really need folks for, because the people who are doing that job currently are doing multiple days to make sure we can keep the service going. So if you're a multitasker who wants a really important job, with a really great team of people, it would be a great opportunity. We have two-way radios in all the vehicles, so there's constant communication going out, and that dispatcher is the one who kind of is the conductor of these people who are out on the road, making sure they're getting to where they need to go in time, and receives the calls from the clients when they're ready to go home, and dispatches it out to the cars. So that is another important thing, but we can always use more drivers. And for drivers, like I say, you just have to have a regular driver's license. You use our vehicles, our gas and everything, our insurance, and we just, we do check the drivers. We have a training process where a current driver rides along to make sure that they're safe. We do the license check, but really it's just.
You have to like people a little bit.
If you like people, it's a job for you because these people just, many of them don't have anybody else to talk to all week, and they get in the car and they just unload and tell you everything about their life. And
he's got the medical transportation senior reassurance program.
and as you said earlier, I mean, the volunteers tell me that they get as much out of it as the clients do.
Yes.
I mean, inevitably, why would these 25 people hang in there if there wasn't some? That said, some of the people who had to step down are heartbroken they can't do it. I've had people, 20-year drivers, who had to stand down, who are just itching to come back, but they're just not comfortable with that yet. And we do volunteer surveys every year, and we get comments back from the volunteers like, I'm 100% invested in this program. I feel a great bond between the employees and the volunteers. Another one was, my volunteer work with the volunteers and staff has been a pure joy. Another, stories shared by the senior riders are worth the price of admission. It's an honor to work with these volunteers. So right there is another statement. Just saying that bond that they get with these clients, it's just incredible to see. If we sometimes, unfortunately, lose a client who passes away, you'll inevitably see the brochures from the funeral on the desk the next day from all the volunteers who went to the funeral to see these people. Yeah. I mean, we really stress the team aspect in our group. We can't do this alone, but together we're powerful. I do the grant writing and stuff, but it doesn't do any good if I don't have somebody to drive the car.
Right.
You can have somebody to drive the car, but if you don't have somebody to dispatch them, it doesn't do any good. So unless we're all in this together, we can make it happen together. But everyone is an important part of that cog, and so teamwork is completely what we're all about.
Well, we've got about a minute left, so I'm going to give the number. So if you're interested in volunteering for that dispatch position or as a driver, and you commit 4 hours a week, basically, right?
Yeah,
to do that on a half-day
we do
shift.
4-hour shifts, a morning shift or an afternoon shift, 4 hours.
You can do more than that, but that's what they ask, 1 4-hour shift. You can call Jessica at AgeWell Services at 559-0476 and find out how you can volunteer. And as always, if you can't remember the phone numbers I'm telling you, can call 211. And they know all of this stuff. So I know this half an hour went really fast. We could have probably talked for an hour easily, and I'll probably have you both back again separately to do this. But thank you so much, Stacey and Mark, for joining me, sharing information about these really important, literally life-saving programs, both of them. Muskegon County is so fortunate to have both of you and your agencies doing this. So to find out more about them or any other health and human services, you can call, text, check the website or whatever for 211. It's call211.org on the web. And in the meantime, stay safe, healthy, wash your hands, and wear your mask. We'll see you next time. Thanks for joining us.